Monday.
I think I'm okay right now.
We got room on the other side there, too.
You can stand like this. Over there? Come on. There you go, darling. There we go. Perfect.
You guys all ready? Okay, Jeff, anytime.
All right. Good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health Dayton, Montgomery County. We're here today to provide an update regarding information as we know it regarding the COVID-19 pandemic. We have a variety of speakers here today that I'd like to recognize initially. We'll hear from Mayor Nan Whaley, City of Dayton, Sheriff Rob Streck for the county, Debbie Feldman, President and CEO of Dayton Children's Hospital, Barbara Johnson from Premier Health, Chief Operating Officer, Brenda Kuhn, Kettering Health Network, Chief Clinical Officer, Tracy Sibbing, United Way, Marvine Mitchell-Cook, Director of Workforce at Montgomery County, and then Mark Donahue, Chief Executive Officer of RTA, and after Rob Streck, got to follow my little logistics here, we're going to hear from Sarah Hackenbrack, President and CEO of the Greater Dayton Area Hospital Association. The lineup changed a little bit from the original printout, so I apologize, Sarah, for not mentioning your name up there front. Okay, so here's where we stand with respect to an update. Ohio, as we learned from the governor's press conference, is at 50 confirmed cases, 12 counties, and very fortunately, 0 deaths. Dr. Acton today from the Ohio Department of Health gave an overview of some of the data regarding those cases. The age range is 14 to 84, with a median age of 51. 14 of those individuals have been hospitalized. So a week ago in Ohio, we were at 0 cases. We are now at 50 cases in Ohio. We remain at 0 confirmed cases in Montgomery County, but we know that COVID-19 is present. We have to recognize and accept that we have community spread of this virus in our county. And so as we've shared over the past several press conferences, our actions have focused on 2 priority areas: limiting the spread of infection and then making sure that our healthcare system is not overwhelmed. Because that healthcare system has to take care of individuals who may have COVID infection, but it also has to respond to all of those other issues that require visits to doctors and urgent cares and hospitals. So we need to make sure that we have the critical infrastructure in place to continue to provide services to our community. So we're all familiar with the fact that we started this control of this pandemic with 2 overarching strategies. First, we started with containment. So as communities across this country, we were monitoring travelers, there were travel restrictions and advisories, and then as we identified ill individuals, we asked them to be isolated or self-isolate at home, and same thing with individuals that may have come in contact with those sick individuals, we asked them to self-quarantine at home during a 14-day period. Well, it became readily apparent that that, quote, containment strategy was not going to be enough to stem this pandemic, the spread of this virus. And so we have moved as a nation and essentially as a world to mitigation strategies. So how do we continue to slow the spread of this virus through mitigation? And we're all familiar with what that means. That means social distancing measures. All right, limiting movements of individuals. Well, the list is pretty long, and the governor has made it very clear that this is what needs to be done to protect the citizens of this state. And that means to protect all of us in Montgomery County. Schools, universities, county jails and correctional facilities, nursing homes, psychiatric hospitals, juvenile courts around those. Restaurants and bars that we were notified of yesterday. We need to clarify, no on-site consumption, carry out and delivery only. By the way, regarding carry-out and delivery, or carry-out, lines for carry-out need to maintain social distancing 6 foot between individuals who are in line. So we need to make sure that if you're going to go to receive carry-out from a restaurant or a food establishment, you're maintaining social distancing while you're in line. But the list goes on. Daycares. We know that the governor has indicated at some point daycares are going to close. Parents, please make plans to care for your children. And then we just learned on the news conference this afternoon that additional orders are being written by the governor and the Ohio Department of Health director. Fitness centers and gyms will close, bowling alleys, recreation centers, movie theaters, indoor water parks and trampoline centers. And there will be no in-person voting. That date has been extended to June 2nd. And then, as we were all aware initially with mass gatherings, less than 100 individuals, the governor informed us now that that is less than 50 people. And we will be complying with the federal recommendation. These are very serious measures because this is a very serious virus. And we all need to do our part to make sure that we limit the spread of infection. I think it's really important to stress what Director Acton from the Ohio Department of Health said today on this news conference. We need to advise the most at-risk individuals to simply stay at home. Her statement was people 65 years of age and older should stay at home and should not leave their home unless absolutely necessary. That's unprecedented in our lifetime. But we need to take that advice, we need to implement that advice because the virus is spreading within our community and we have identified individuals most at risk. If you're an elderly individual or an older individual, especially if you have underlying health conditions such as heart disease, diabetes, obesity, you are at serious risk of health complications associated with exposure to this virus. Individuals who are immunocompromised are also at great risk. And although the data really, we don't know all the data regarding at risk for pregnant women, obviously pregnant women should limit their exposure around others as well. So, there's a lot happening. Our intention as a system of partners is to provide you an update every single day to where we can communicate to you actions we are taking in our community to protect you based on what the governor has ordered. So before we turn it over to Mayor Whaley for some comments, I do want to revisit for a moment testing. Obviously, there's tremendous concern around the availability of test kits. Let's just be clear. If you are not sick, you do not need to be tested. I think we need to say that again. If you are not sick, you do not need to be tested. If you feel sick, but it's like you would normally feel, and you would normally not go to the doctor, stay home until you feel better. When your symptoms get to the point where you know something is not right and you really need to see a doctor, call your doctor to talk to them ahead of time. Once you're there, then, your doctor will determine if testing is necessary. We want to make sure also that we don't overwhelm our emergency departments because our hospitals have to be able to provide care not just for COVID-19 patients, but for everyone else who may need hospitalization. So, with that being said, I'm going to turn it over right now for some comments from Mayor Whaley.
Thank you, Jeff.
Just want to be very brief today. I'm really pleased that we have so many different folks that are doing all they can across the community as we prepare for this public health crisis. As Jeff mentioned, the governor announced this afternoon that there will be no in-person voting on Election Day, that it will be extended until June 2nd. I know it's a very serious day. I don't think there's ever been a time when there's been an extension or postponement of Election Day. So we are taking this very, very seriously. We encourage everyone that's 65 and older to not leave their house. If you need something, call a friend, phone a family member, phone somebody that is not compromised. What we're trying to do is to flatten this curve so our health providers can be able to continue to provide for our community through this long term. That means healthy people need to pay attention, as well as people that may be compromised, and so we're asking for everyone to be in this together by staying apart. I really appreciate the Health Commissioner's leadership and the leadership of the entire community, from the Dayton Foundation and the United Way to our health centers doing everything they can, as well as our teachers and schools, of just doing a yeoman's job to make sure that kids are still providing some education but also being fed in the city of Dayton and across the county. With that, I'll turn it over with the County Sheriff, Rob Streck.
Hi, everybody. I just want to echo what Mayor Whaley said and thank the health department and all the local hospitals and everybody. You're doing great work dealing with something that changes by the hour. So as Montgomery County joins the rest of the world with the pandemic, public safety is our #1 concern. Our mission statement is to meet the community safety needs, make sure Montgomery County is a safe place to live and work, and that is our #1 priority. I assure you, deputy sheriffs, dispatchers, corrections officers, and all of my support staff are still protecting and serving. The criminal justice system will not stop, and everything will proceed as normal. The governor has declared a state of emergency. My deputies are prepared to enforce those orders if necessary, but it's important to know that we have not had any compliance issues. The crime rates have not spiked, and our calls for service are actually down a little bit as compared to some people keep asking if it's up and we're having a crime spike, and the answer is no, not at this point. So we want people to be kind to each other. Don't go buy up every supply in the store if you don't need it. Remember your friends and neighbors. When you're shopping, be courteous. Drive safely to get to that area you're shopping at, and make sure we remember others. We have had disputes, although not over the weekend. It seemed to have calmed down, but when this first started hitting and there were floods and floods of people going to the stores, there were reports of disputes, there were reports of arguments over food and other supplies. So remember your neighbor, be kind, treat others how you want to be treated. Remember to check on your family, friends, and anyone who has a medical condition that may be letting that medical condition go right now because they are afraid to go to the hospital or the doctor. So it's up to us to check on those people, those individuals, to make sure that our loved ones are being taken care of. Keep an eye out on children while they're not in school. There's going to be parents that are at work and their children are home alone. If you know your neighbor's kids are home, watch them, check on them, keep up on things like that. Once again, my main topic here today is watch your neighbors and your family and your friends. We also want to watch out for scams. We know from the Memorial Day tornadoes that most people step up in emergency situations and help, but we always have the predators out there that are looking to get financial gain off of others' tragedies. So always make sure that you don't give out your personal information, that you check on charities who are calling to make sure that those charities are legitimate, and don't always believe everything you hear or read online or on social media. The best place to get real information is Dayton Montgomery County Public Health website or the CDC's website. Most other people's websites up here also point to those. The Sheriff's Office, if you go to our website, it points to public health, because we want people to have the most important information they can have. Last, talk about see something, say something. If you're in your neighborhood, if you're out and about and you see something suspicious, call, report it. Don't be afraid to ask the police to go check on something. If you see someone at your neighbor's house and you think it's suspicious, call us. That's what we're there for. If you are served by the Montgomery County Regional Dispatch Center, The non-emergency number is 225-HELP, 225-4357. If you're not sure what dispatch center you are serviced by, this is a great time to find out, so that if you see something that is not an emergency, you can call those non-emergency numbers. Please remember to save 911 for actual emergencies, fires, crimes in progress, things like that. Every dispatch center has a non-emergency number that you can call, and always remember you have to dial the area code now. Once again, proud to be your Montgomery County Sheriff. My people are here to serve and protect, and we will all get through this just like we've gotten through everything else, as long as we follow the advice of the professionals standing behind me. Thank you.
Next, we have Sarah Hackenbrack, President and CEO of Greater Dayton Area Hospital Association.
Thank you, Health Commissioner. Good afternoon. This is a reminder that as of today, Monday, March 16th, our area hospitals have implemented more stringent visitor restrictions to ensure that we're protecting the patients that are under the care of our region's hospitals and to assist in safeguarding our region's healthcare workforce. This is an absolutely vital step, and we applaud the direction that Governor DeWine has taken with so many measures to protect the safety of our population and our residents here in Ohio, and our hospitals are very much following Governor DeWine's lead in this effort. And as we continue to move forward, it is also critically important to remember that when someone is seeking a test for COVID-19, that is a test that can only be ordered by your physician. So you have to have a physician's order for that test. It's very important to know that you can't simply walk into your doctor's office, your urgent care, or into your area hospital and request to be tested. And that's why the Health Commissioner was so imperative, stating that you need to speak with your physician who knows you and knows your health status to understand whether you're someone who needs to be tested at this point in time. And we have some wonderful leaders from our area hospitals that will be joining us next.
Next, we have Debbie Feldman from Dayton Children's Hospital.
Thank you, Jeff. I want to thank the Public Health Department. They have done an incredible job of working with all of us, as well as our Dayton Area Hospital Association. The hospitals are working extremely closely together, and I know you're going to hear from all of us today. I'm going to speak, though, about children. That's why Dayton Children's is here. We are here so that every child in the Dayton region has access to great pediatric care. Based on the science and the evidence so far, talking to our colleagues around the country, the world, the children of our community should be much less severely impacted than our older adults. They may be carriers, they may even get sick, but it seems that even the youngest patients, just even a few months, have recovered well. That being said, we know our patients are nervous, our parents are worried, and understandably so. We have been getting a lot of calls to our emergency department and hope soon to have a better way for families and who have concerns about COVID-19 to get answers. So we hope to have that very soon. We have been on the phone just a few hours ago, once again, with Seattle Children's, who of course has been at the epicenter of this in the United States, and have gotten great advice for them, and they have once again reaffirmed that they are not seeing children, many children who are impacted by this virus. So that's to reassure our parents. Certainly we want them to be in tune to their children's health, and we want to be there for them, and certainly their primary care physicians want to be there for them, but we do want to reassure them at this point we do not see this virus impacting children in a significant way. We are working very hard to reduce the footprint of people coming into Dayton Children's, not only to protect those visitors, but frankly to protect our caregivers. We have to keep our caregivers healthy. So we are working, our providers are working with families to determine what is the best avenue for their child's health care at this point. So we are reaching out to those families that have routine clinic visits at Dayton Children's. Every day we see almost 1,000 children that are coming for routine or new visits to our variety of specialists. Those providers are reaching out to families, determining what is the best way to address their care, whether it needs to be in person or whether it could be through a virtual visit, or we could reschedule that appointment at a later date. But to be clear, we are still seeing patients with new appointments. It's very important that we not forget that we have regular ongoing health care needs that must be addressed by our physicians and our providers. We don't want our children not to receive important care that they need to receive. We are also continuing to have medical imaging at Dayton Children's. This is important diagnostic services that need to happen. They will continue at our main campus and at our Springboro campus, though we will not be doing sedated imaging at our Springboro campus. Things are moving very quickly, and we're continuing to try to get information out as best that we can to our families. Again, on our website, we have a great deal of information that is specific to children. So we would ask our families and our parents who have concerns to look at that website. It links to those important sites also that were previously mentioned. We really want to reiterate that this is the time to get good information. Come to our emergency department if there's a legitimate health care need that a family has, but don't come if there's just a general concern. Look at those websites, talk to the primary care physicians, in our case, family docs and pediatricians, and we will continue to work very closely with our adult providers as they really tackle what will probably be the biggest challenge here. We stand ready to help them in any way we can. Thank you.
Next, we have Barbara Johnson, Chief Operating Officer at Premier Health.
So, good afternoon. Debbie Feldman led with a thank you, and I too really would like to probably represent the other providers in the space and say how extraordinarily and extremely grateful we are for the outpouring of support. Our hospital systems, locally, regionally, are together in this crisis. Our health department has been phenomenally responsive and supportive. Our EMS and first responders are doing what they do best, and we are counting on them each and every day to get us through this crisis. Our academic partners have all rise to the occasion. UD, St. Clair, Wright State University are all partnering with us in this space. The City of Dayton, Mayor Nan Whaley has been amazing and keeping us up to date and well informed. Even our local Ys, our daycare centers, our local media is reaching out to us so that we can provide accurate information on demand. And then Premier Health is also beginning to work with our local churches and community centers to make sure we can provide education and support out there in the community. So I want to start really high level. So at Premier, as with the other healthcare providers in this space, we're dedicated to protecting our patients, our staff, our providers, and this community during this outbreak. While we have not had any admitted patients in any of our hospitals for COVID-19, we do have special isolation rooms in place for patients who we suspect might be sick with COVID-19. We have negative pressure rooms designed to prevent airborne bacteria from escaping and spreading to the other areas of the hospital. We have also set up an incident command center at every single one of our hospitals, and we also have an incident command center set up at our corporate office. We have internal hotlines for our physicians and employees so they can rapidly get answers to the questions that they have. We've taken several steps to ensure that we have adequate staffing to care for our patients. And like much of the community, we are trying to hold our meetings virtually and remotely whenever possible, and we have suspended all business travel. We just hosted our first leadership meeting virtually with about 230 individuals on that meeting, so we have deployed throughout our system this IT capability. So much of preparation is about staying informed. And we have been working to do that internally through our intranet site and point the community to public health resources on our website. We've set up processes to establish separate flows for patients in our emergency departments and our other sites of care so that individuals who present with flu-like symptoms are managed in one space and those that do not are managed in a separate space. And then I want to drill down just to get a little bit more specific. I think it's critically important that you guys know how much work is going on inside our hospitals and health sites to keep everyone in this community safe. So we have each site, again, has a command center that's running 24 hours a day, 7 days a week, and will stay up and running until we get through this crisis. We have telemedicine available, so we are definitely making sure that we advise our patients that telemedicine and telehealth options are available to them, because as Debbie mentioned, we want everyone to continue to get their health care provided at the right site for the right reasons. So please, we're encouraging everyone to maintain their primary care visits and their wellness visits when ever possible. Our EDs are ready to conduct split screening, meaning curbside triaging will take place so we can keep patients segregated based on symptoms. You'll begin to see tents adjacent to our emergency departments to begin that split flow screening. Currently, we are managing all volume through the ED without disruption. The emergency department, thank you. So watch me, because if I use acronyms, stop me and I'll be clear. Our staffing levels are appropriate and our current inpatient and outpatient volumes are being managed well. We are offering work from home options for non-healthcare provider employees. We are redeploying staff based on need if their business unit is disrupted due to service curtailment. We've established both internal and external child care options. We're working with our local healthcare providers and others to make sure that we can get child care options available to all of our providers so we do not disrupt care in this community. For food service safety, we are only providing food service options to our staffs that are covered, and so that means they'll be getting grab-and-go items. We will have no open food items in the cafeteria, and in fact, we've even removed all seating in our cafeterias to make sure our employees remember we are doing social distancing. Our supply management, we are managing our personal protective supplies to ensure appropriate use to keep our frontline staff and providers safe. In environmental services, we've stepped up cleaning in all our public areas. Patient care areas are on constant surveillance for servicing and cleaning, and then we are deploying our robots in our ORs and patient rooms for deep disinfecting. Visitor restrictions, you already heard that we are rolling out visitor restrictions, and we will also be limiting our access points so we can do appropriate screening for any visitors that are coming into our healthcare system. And then any non-essential traffic, like our vendors, are all being asked to curtail their visits to our facilities. We are going to be announcing a collection center for anyone who needs to come and be tested. As you heard from Sarah and others, testing is limited and requires a physician order. So that's my update from Premier Health. Thank you.
Next, we have Brenda Kuhn, Chief Clinical Officer at Kettering Health Network.
Good afternoon. First of all, I would like to thank our city leadership and the leaders of the other organizations here with us today. We all play a vital role in keeping our community safe. As we saw with the tornadoes and some of the other events this year, Dayton Strong has taken on new meaning for this community, and we see that continue to play out as we collaborate together to keep our communities safe. I want to particularly thank our healthcare colleagues, both Premier Health and Dayton Children's. While we often compete, right now we're working very closely to make sure we can use resources together and that we're creating processes that support safety for our patients and our staff. I want to continue to remind everybody what the Health Commissioner mentioned as he started. Each of us should be washing our hands. We need to make sure we're practicing social distancing. If you have a fever or cough, please stay inside and self-isolate. If you become short of breath or that continues to progress, that's when you would go to the doctor. As they've mentioned, we do have tests, but these tests are limited to patients who meet the requirements for CDC. And right now, that's mostly patients who we believe are going to be admitted to a hospital. I would like to share just a couple of highlights on what we're doing as a network. Barbara went into a lot of the details that we're following from a healthcare organization. First, we also implemented our command center about a week ago, and we're running 24/7. This allows us to stay up with any changes that are happening and to put processes in place. We have hundreds of professionals, both clinical and supportive, that are making adjustments to our daily operations so that we can have resources to support the processes that are being put in place, such as the visitor restriction, and we will begin screening employees as well. Second, we are using our network operations command center so that we can track all of our patients where they're at across the network, so we can manage our emergency department volume, we can watch our isolation rooms and ventilators, which are critical during this time. We're able to watch and make sure that those resources, that we have enough capacity, and as that volume changes, that we can respond as appropriate. Lastly, as a network, we're a faith-based network, and so we believe in the importance of keeping God in the work we do. So we have been praying for the community, all of our leaders, all of our patients, all of the staff, and want to continue to partner so we can ensure that as a community we get through this safely. Thank you.
Next, we have Tracy Sibbing from the United Way.
United Way is hosting a conference call tomorrow with community leaders to identify service gaps that will impact individuals and families as a result of COVID-19. Once those service gaps and needs have been identified, we will respond quickly as possible to address them. There are many organizations already adapting their services to meet the immediate needs of their clients, and we want to thank you for being flexible and quick to step in to support our neighbors. United Way is aware that some funded services will not be available during this time, and it's our intent to continue providing grant funding to support those organizations for as long as possible. United Way, in collaboration with the Dayton Foundation and other community funders, also will be asking for financial support and volunteers to help with the increased financial need for services that we know will be coming. Our appeal will be for supporting nonprofit service providers through our existing channels and others who are already best positioned to help address the gaps. I want to emphasize the importance that individuals wanting to volunteer should be asymptomatic, not considered to be in the vulnerable population, and practice ongoing hand washing and social distancing while participating in those activities. Our Volunteer Connection program is working to compile a list of activities requiring additional support, and we will be sharing those opportunities as we receive them. Our United Way HelpLink 211 service will work in conjunction with the City of Dayton, Public Health, and Montgomery County and others. Within our 9-county network of HelpLink 211 services, United Way will assure people have access to the information that they need. We ask the nonprofit service providers to update any necessary changes that have been made to their service delivery so that we are sure to give clients the most accurate information when trying to access the supports that they might need. United Way will continue to be available to support our community and to work with others to assure that individuals and families have what they need during these challenging times. Thanks.
Thanks, Tracy. Thank you.
Next, we have Marvine Mitchell-Cook, Director of Workforce at Montgomery County.
Thank you. As you know, currently with unemployment, because businesses are closing and people are being laid off, we have to value the unemployment process. On March 15th, on yesterday, Governor DeWine and Lieutenant Husted, they changed some of the requirements for unemployment to make it easier for people to apply. One of the major changes is they waived the requirement to seek work while receiving benefits, and standard 1-week waiting periods is also waived. They also are stating they would prefer that you look at the website, unemployment.ohio.gov, in order to apply. There is an hour and 45-minute waiting period if you call by phone. I have that number as well. The number is 1-877-644-6562. The TTY availability is area code 614-387-8408. We also at the Job Bank will be providing services in order for you to come and apply for an application of unemployment. We are open from 8 to 5. We have essential employees that will be there to assist you. Also, when coming into employee session, we would like for you to only have 50 people per person. We will monitor that as well. In conclusion, I would also like to say our youth services, Career Services 365, is still open for youth applicants for summer employment. We have closed and/or postponed our current hiring events and our career fairs. Thank you.
We also today have Mark Donahue, Chief Executive Officer at the Greater Dayton RTA.
Thank you, Jeff. I think most people know our buses carry about 30,000 people each day. For many, we are the only option they have to access their jobs. By the way, many of which are entry level, such as those working retail in the grocery field and the folks that are burdened with the cleaning and disinfecting of our world, as well as their personal and grocery and pharmacy needs. We also connect people to critical medical appointments such as dialysis on both our fixed route big bus service and our door-to-door services. Today we will move over 200 individuals just for dialysis. We are a critical component of the infrastructure, just like the healthcare professionals, airport workers, and the like. RTA will continue to operate its regularly scheduled service. Our team is committed to providing this critical link so the citizens of the Dayton region can access their jobs, medical care, and necessary shopping during the crisis. We will persevere and provide the highest level of service possible based upon the realities we face each day going forward. We have spent the past several weeks attempting to procure additional supplies to expand our sanitizing and disinfecting protocols for our buses and facilities. We are undertaking efforts to do what we can with the available supplies. We are also in contact with our federal, state, and local partners on how best to maintain safe operations, and will continue to attempt to procure additional supplies. At this time, we have distributed hand sanitizer for use while at RTA, disinfectant wipes for our work surfaces, and some individual hand wipes for our drivers to carry with them. Our maintenance team has stepped up nightly disinfectant cleaning inside buses. We're working a lot of overtime to do that on all touch points, such as the hand and grab rails, the fare box, and seat back frames. Vinyl gloves have been made available to our drivers, transit ambassadors, maintenance staff, and our field supervisors as well. Our custodial teams at all our facilities are making additional efforts to disinfect touch points. We appreciate the commitment of our employees and the patience and support of the public as we face this unprecedented crisis together. We will continue to update and inform our employees through the RTA Info Hub and customers via social media, our website, and information sharing with our partners. Thank you.
Thank you.
First of all, Public Health would like to thank everyone who came here today to share information with our community, to make sure that everyone stays informed. It should be very obvious that tremendous work is being done by all community partners in this room. And I think that's the take-home message. We can't do this alone. We have to be united as a community, all working collaboratively under one umbrella to make sure that we best serve our citizens in this, perhaps their greatest time of need within their lifetime. We're all in this together. So, in closing, before we answer any questions, I would just like to say that on behalf of Public Health, let's show empathy and compassion for others. Let's make sure we're caring for our family members, our friends, our neighbors, our coworkers, and let's make sure our children are protected during this. So thank you, everyone.
Questions?
Or maybe since you brought it up, when you talk about the collection centers for testing, I know we talked a little bit about it earlier today, your organization, mine, WHIL. Can you offer any more details about where those are going to be, what they look like, and the importance of not just showing up once they're established, but having a doctor's order to get a test?
So I appreciate the question. I don't want to get too far out over my skis. I know we're going to be making an announcement later on this evening about where that collection center is going to be located. It will be in partnership with one of our school partners. The collection site, again, is going to be available for those who have an order from their physician, and we will be collecting samples at that site. There will be no actual testing going on at that site. It's just a collection center.
As part of whatever procedures might be in place there, Barbara, we've heard a lot from medical experts about the importance of not just showing up to an ER, to a doctor's office unannounced, but along those lines, protecting the medical workers who are on site so that they're protecting the health of possible COVID-19 patients, so the healthcare providers.
And I appreciate that question too. So I think it's really important because people are nervous. We don't want the worried well to inundate our emergency departments. So please, if you are having symptoms, we will ask you to go through appropriate screening protocols. First, start with a phone call to your primary care provider and explain to that provider what is happening with you. That provider will be the one that will give you the appropriate direction as to what course of action you should pursue. That way it won't overwhelm our emergency department.
Kind of speaking to that, if you don't have a primary care provider, what do you do?
So the question is, if you don't have a primary care provider. So again, I would suggest, that's why we have our public health partners here with us today. You can go on site and find out what's the best location for you to perhaps get in touch with what's available for you in terms of testing, so that we can make sure that we are providing the most accurate information to individuals who may not have a primary care provider that's attached to them. They can always go on our lines, go on our website. We'll have information for anyone that's looking for how to reach out and get connected with a care site.
Is there any other plans to set up more remote testing sites, kind of like this one?
So this is an active conversation with healthcare providers and hospitals all across the region. And so we recognize that the current limitations in the state of Ohio of around 1,200 to 1,500 tests are insufficient to meet the need, but we do recognize that these are still tests that require a doctor's order. And as Jeff has said in a number of other conversations with all of you, 80% of the individuals who are going to come in contact with COVID-19 are going to be able to manage their symptoms at home. They're not going to need to come in for a test. They're going to be able to manage the symptoms at home and take care of themselves, isolate themselves from the public for a couple of days, and then life will slowly start to return to normal. And so as we start to identify options for additional testing, these will still be sites and they will still be options to collect testing samples throughout the region, and those will be done, again, under a physician order.
Hold on.
Yeah, so we should revisit for just a moment the question on what happens if I don't have a primary care provider, and that's really difficult. It's a question that it's not just surfacing during COVID-19, but we know that it needs to be part of the discussion in terms of how we move forward as a community. So as we get further advice from the Ohio Department of Health, as we understand assets and resources in our community, Public Health will be placing information on our website in terms of individuals who are uninsured or underinsured, how they can have equity in this and receive the same services as the rest of us. So we'll clarify.
Jeff, two quick questions on quarantining. The first one real quick. How do you know the difference between when you should be full-blown 14 days, whether you should just be staying home until you feel better? What advice do you offer about self-quarantine?
So if you know that you have been exposed to someone who is laboratory confirmed as infected with COVID-19, you should stay home for a 14-day period. The incubation period, based on all the available information, is anywhere from 2 to 14 days, with an average of around 5 days for the vast majority of individuals.
So just to clarify, if you touch somebody March 7th, if you've been in touch with someone COVID-19 March 7th, you stay home till March 21st?
But if you've got a fever and a cough and you're not confirmed, you should just stay at home until you feel better. Like, how long do you think it was after you start feeling better?
You want to talk? We'll have our medical director. Yeah.
Hi, good afternoon. I'm Dr. Michael Doe, and I'm the Medical Director for Public Health, Dayton, Montgomery County. The question put together, quarantine and isolation, those are two whole different things, okay? So the quarantine is if you've known you've been exposed to somebody that has this disease, then it may take up to 14 days before you're going to show symptoms, so that you need to do that whole 14 days, okay? On the other hand, if you're sick, you should wait until you get better, and that may be less than 14 days. And as we've said before, people with mild disease, we're encouraging them to stay at home, keep away from people in the household, maintain that physical distance, make sure everybody washes hands, don't share personal items like glasses, etc. And those people, maybe they've got coronavirus, maybe they've got the flu, maybe they've got some other virus, okay? And so those people are going to run their course, whatever it may be, and at some point they'll be better. And when we're better, we lots of times know it. Our fever goes away. We're not taking medicines to keep our fever down, and we're okay. We haven't got the cough. We've recovered. And at that point, check with your work or employment if you're going back. Let them know, see what they want to do, and then return to your life.
Jeff, the second question on quarantine. I talked to a guy who lives in Washington Township. He was on the Grand Princess, docked in Oakland. He had to quarantine there. He's been flown now to Dobbins Air Force Base in Georgia. He's continued to be quarantined there with his wife. They're both asymptomatic. He basically wants to know, why can't I come home and self-quarantine in Washington Township? So whose bailiwick is quarantine? Is it where you're at, and he's now under Dobbins Air Force Base for quarantine there? Why can't he come home to Washington Township and just
Right.
stay home?
We've known that there are people out there who are at various federal facilities and that are under quarantine. We've actually talked some about, gosh, we wonder if there are any citizens from Montgomery County or Dayton. So now we know that there are. The fact is that we here in Montgomery County, in public health, have been sort of bringing people back since early in February, the beginning of February. And as we receive them, we can make arrangements with them for whatever they may need. Some of them have had some quarantine time before they get here. Others are just fresh off the plane, so to speak. And so we work with them to see what needs to be done in order to protect the citizens here, as well as to make sure that they get the best possible care and supervision, so that we are ready to receive those people at any point. Okay? It's not our decision when the people get here, so that is as a decision that's made elsewhere. Whether there are particular circumstances, we don't know. We only know we'll find out when the people arrive. And so between the federal government and the state of Ohio, there may be answers, but we're not part of that process. I understand that's maybe not a real satisfactory, satisfying answer, but, for us too, we would like to get those people back probably, because we understand they've been kept on the ship for a while, now they're being kept in an Air Force base. And really, at that point, all of us would just want to come home.
But basically what he's conveying to us is the feds are telling him, you're quarantined here, so he's over the federal government. It's not your decision to bring him back to Washington County.
Exactly,
Correct.
exactly.
DOJ is telling him, you must stay here at this airport.
Yeah, that's a decision that's out of our hands. What we do is we welcome people back and say, here's what your situation is, here's what we can do.
But we don't hug them.
That's right. We may welcome them back by phone, so.
Are the tests done locally or tested locally, and if not, I guess where do they go?
Go ahead.
Well, the first question was, are the
Like,
tests done
when someone
locally?
gets tested, is that test then tested locally, or where does it go, and how long does it take, I guess, to get results?
Those are excellent questions. The testing capacity, the network of clinical testing in this country is fairly broad. So that once those samples come in, they would go then to some clinical laboratory, and they would go to wherever that clinical laboratory can do that test. Those that come to the Ohio Department of Health are done in Columbus. Okay? For the commercial laboratories, they may be going to a number of different places depending on the commercial lab, and also depending if they have multiple test sites. Okay? And so where the actual test is done is going to be in a clinical laboratory someplace. But, where that is much less important than the fact that they're going to keep track of it and that we'll get the results back. Okay.
We good?
All right.
See you tomorrow.
Thank you.